Unfortunately, you're probably consuming way too much sugar. The average individual is consuming over 125 pounds of sugar every year, and you may be one of them. But here's the good news. Your body will actually give you some warning signs and tell you to stop. You're consuming way too much sugar, but you have to know what to look for. And that's why we're discussing the 7 unusual signs that your body is telling you you're eating too much sugar, with the very first being that every time you eat sugar, you continually want more. When you first started eating sugar, a tiny little bit of sugar probably really satisfied the pleasure centers in your brain. And today, maybe after doing it for many years, a massive amount of sugar is required in order to get that same pleasure response in the brain. So essentially, you constantly want more and more sugar in order to feel satisfied. If that's you, there's a problem. Now, the other big change that you'll see is the way that you perceive food, right? The taste. And I can tell you that one of the biggest changes I noticed almost immediately when I went sugar-free is I started to enjoy food for very different reasons. I enjoyed the flavors, the spices, the herbs, and the natural taste of food versus always seeking out that taste of sugar. So you'll notice that if you're eating a lot of sugar, you literally just crave that sweet taste all the time. But if you don't eat a bunch of sugar and you go sugar-free, you start to actually appreciate food flavorings for what they are. Now, the next thing here that you're going to notice is that your immune system is terrible. You're not only someone who gets sick often, but also you don't recover well. So you want to make sure that you're not eating too much sugar and destroying immune system function. It's really interesting because so many people become very, very sick around the time of holidays. And if you think about this, right, we have events like Halloween where kids are getting a ton of candy. Then Christmas comes and everybody's eating a lot of candy and sugary foods. And then we have New Year's where there's more party and sugary foods and desserts. And as a result of all of that, well, it crushes your immune system. And this is a big reason many people become very sick around the holiday season. Not only are you not getting enough sleep, but you're eating way too much sugar that's destroying your immune system function. Hey, it's Dr. Z, and I want to help you improve your health naturally because true health only comes naturally. The best way to stay in contact with me is by joining my newsletter. Nobody cares about your health like I do. Click on the link below this video to join my newsletter and we'll stay connected for life. The next is metabolic syndrome. This is a big factor that over 90% of people suffer from. I'm talking high blood pressure, high cholesterol, fatty liver, high blood sugar, the risk of type 2 diabetes and heart disease. The list goes on. You have weight issues. You can't lose weight. You can't get rid of the belly fat. This is a big problem for so many individuals. And unfortunately, most people don't actually relate this back to eating too much sugar. But let me share with you something really quick about testing that's very important that you have to know about to truly understand this topic. When you go and get tested, there's a few things that you can do in order to actually determine whether you have too much sugar in your diet. So whether you're going to your doctor or working with me here at New Vision Health Center, one of the things we'll look for is glucose, okay? And this is going to give us more of a snapshot in time as to what levels of sugar you have in your body at that given time of taking the test. It'll tell us if you're pre-diabetic or type 2 diabetic. Now, the next test we'll do as kind of an insurance policy is we'll look at your insulin levels. And this is very important to know because when you go to the traditional doctors, they never test your insulin levels. But we do here in more of the functional nutrition aspect simply because we want to know how high your insulin levels are. If they're very high, there's a few things that will happen. You won't be able to lose weight, and also it's going to shove down this blood glucose, making it appear that you don't have blood sugar issues. So you could have normal blood glucose and very high insulin levels causing a lot of symptoms for you, all while your doctor is telling you you're fine. Now, the other thing that we check is your hemoglobin A1C. And your A1C is essentially going to give us a historical timeline of what your blood sugar has done over the past 3 months. So that way we know, has it gotten worse? Has it gotten better? And we can use all this information to really dial in your health. And so this is how you're going to go about testing for blood sugar, which is a really good thing to do, along with combining it with many of these different symptoms. We'll talk about mood swings next, okay? So if you have irritability issues, maybe you're even suffering from depression, anxiety, and some different mental health disorders, you want to consider taking sugar out of your diet because sugar drives inflammation. Inflammation in the brain causes a lot of brain issues. And so if your mental health is struggling and if you have mood swings throughout the day, then you're going to find that you're going to take sugar out and a lot of this stuff will start to go away. Next is fatigue. And the reason for this is because when you consume sugar, it gives you this high, but whatever goes up has to come down. When you have big blood sugar spikes, your insulin levels will raise rapidly. And when they raise, it'll shove that blood sugar down to a point where you'll actually have blood sugar that's too low, which will cause fatigue. Now we're talking skin issues, because if you have acne, if you have rashes, any of these different skin issues that many dermatologists sell you really fancy creams for, well, you're going to want to just cut sugar out, and this alone can dramatically decrease these skin issues that you're suffering from. And then also stiffness. If you're somebody who wakes up every day and you're stiff and your joints are stiff and nothing feels good, then you're going to want to start decreasing sugar, and this alone will be a game changer and make your joints feel so much better. So two of the things I didn't mention yet is that you could have headache issues as a result of consuming too much sugar, and also obviously dental issues, whether it's gum disease or also a lot of problems with cavities. It's the bacteria that is eating your teeth away, fed by sugar, that is causing cavities. So watch out for that. And now let's talk about some different ways that you could actually remove sugar from your diet, because one of the hardest things for people is removing sugar from the diet, simply because of this pleasure response we talked about before, or you're getting headaches from removing sugar. So what we like to do is we always like to use lateral shifts here. And the way that we actually go and implement these lateral shifts, and we don't harshly discipline ourselves to just give up sugar, but move to a more healthier option. And so if we go sugar-free, we can use things that are sweet to the tongue, but yet don't raise our blood sugar. These different sweeteners are going to be stevia, monk fruit, allulose, and erythritol. These are my favorites to go with. Now, some of you may ask, well, you didn't put xylitol on there, and in the past I have promoted xylitol as being a good alternative. I don't utilize it quite as much, as because it's a sugar alcohol that can be pretty harsh on the gut for many people, and plus today we have many better options. Allulose is a big new one that has come on the market and is fantastic. In fact, when you consume allulose, it's been shown not only to lower your blood sugar, but also your insulin levels as well. So it tastes sweet and it lowers your blood sugar. Like, it doesn't get any better than that. And so these are the sweeteners I like to stick with here in order to make that lateral shift from consuming sugar to going sugar-free, but yet taking the edge off with something sweet. I'm Dr. Nick Zyrowski. Give this video a thumbs up, and also don't forget to subscribe to the channel. It was an absolute pleasure seeing you in this video. I look forward to seeing you in this video next.